Hello everyone, my name is Diana. I will be presenting my applied project, which I have chosen to complete on. The title is Will Functional Communication Training PECS Reduce Screaming Behaviors Across Participants Diagnosed with ASD, Autism Spectrum Disorder. Due to their inability to communicate their needs, children with ASD frequently suffer from severe communication impairments, which can result in problematic behaviors like aggressiveness or self-harm. The screaming behavior makes it difficult for each participant to communicate their needs and desires to those around them. Screaming behavior will be replaced by teaching participants how to communicate using PECS. Teaching them how to communicate their wants and needs will improve their general quality of life and foster positive relationships with others. It has been demonstrating that teaching kids alternate communication techniques through functional communication training with the picture exchange communication system PECS works well. This study is significant because it examines the effectiveness of PECS, an evidence-based intervention that may reduce frustration-related behaviors and support nonverbal children in expressing their needs. My research question was, will 3 children with autism diagnosed exhibit less yelling behavior after receiving functional communication training and picture exchange communication systems? My participants are both female and male, ages 3 to 4, and they are nonverbal and have very limited communication skills. They're all diagnosed with autism spectrum disorder. This study was concluded in a therapeutic clinic setting. Research has demonstrated that PECS is a useful tool for teaching nonverbal children with autism communication skills. The purpose of this study was to determine whether PECS can be successfully used in typical training settings by investigating its effectiveness in a typical ABA therapy setting. Teaching functional communication training PECS would be the independent variable in this study, whereas screaming behavior will be the dependent variable. A multiple baseline design across participants was employed for this study. This kind of approach was chosen because it allows the measurement of intervention effectiveness across participants, and since teaching functional communication training PECS is a non-reversible. I gathered my data by employing event recordings in 30-minute sessions spread out over 5 days of the week. In order to monitor those changes over time, the frequency of the independent request was recorded and examined. My baseline procedures: the children were watched in their natural settings without any assistance or communication prompts during the baseline phase. The graph shows that there was a high frequency of screaming and a low frequency of manding during the baseline. We were able to determine the frequency and content of this spontaneous communication attempts throughout this time. As the intervention phase began, the PECS was presented and instructed. The participants were instructed to request desired things by exchanging images of them with the therapist. Exchanging the picture exchange. Following the intervention, the graph shows a decrease in screaming behavior and an increase in the frequency of manding. The graph findings indicate that the intervention was successful in teaching the participant how to use the PECS for instructions given in the graph's finding. It can also conclude that the intervention worked for all participants. The data in the graph suggests that the participants have mastered the usage of PECS as an effective means of communicating their requirements to others. Additionally, it demonstrates the frequency of screaming has decreased across all participants. Further observations may be needed to use if this skill has been generalized in other areas. The next stage in teaching manding might be to introduce participants to other goods, not just the snack time. So they can mand for a wider range of things. One of the study's limitation is it did not include certain behaviors like tantrums that involved falling to the ground and lying on the floor without yelling. The therapist responded to these situations by applying the same standards for the screaming behavior. I intend to incorporate all behaviors that happen throughout the study in the future. I want to thank you all for your time.